and ours was the first they found, and then they bombed on us. Like,
Yeah, but how did they know it was a black
That's
organization?
yeah, that's what I
either
was gonna
they,
say. They would have to, really do some
They would have
not
to
too much
know
searching, but they would
about
have to go the extra mile, you know what I mean? Because they had that thing ready on cue. Like it was a thing that said, get on with the prayer.
mhm.
all right, so family, we are live on YouTube, on our YouTube channel. So I'm gonna get started. But before I get started, just a quick update to those who may be listening to this playback. This morning's conference call, April the 7th, 2020, was infiltrated by hackers slash white supremacists. So we had to end the first conference, and we're starting again. It's now 7:25 a.m. So I'm going to get started with our opening prayer, and then we will continue on with our meeting and to provide our updates. So I'll get started. O Amen Ra, Mother who feeds us, Father who protects us, you watch upon the creation, you are the creation. O Amen Ra, your breath is the pulse of the cosmos, your shadows cover the universe. From east to west, from north to south. O Amen Ra, my heart is humble before your majesty. O Amen Ra, protect all of us. We are mortal and fallible. Remove from our path all obstacles and protect us from illness, meanness, greed, and envy. O you noble spirits, you watch upon the creation. You are the creation. We feel your presence in water, fire, earth, and air. We can hear you in thunder and the ocean's waves. Your brilliance is that of the stars in the midnight sky. Your radiance is that of the sun in the noon sky. O you noble ancestors, you watch upon the creation. You are the creation. Our blood is your blood. Our flesh is your flesh. Look after us, we implore you. Some did not wake up this morning. Some will not go to bed tonight. Keep us alive. Keep us healthy. Protect our children and their children. Protect our wives and husbands. Protect our neighbors and friends. Protect Africa, which needs it so much. Protect us who testify today about your greatness. Protect us, we who keep shrines dedicated to you and your glory. O you noble ancestors, the day is long, the night is long, and the opportunities to betray Ma'at are numerous and constant. Allow our heart to be inundated with Ma'atic thoughts. Allow that from our mouth only comes Ma'at and Ma'at only. Give us the courage and the strength, the integrity and the determination to fight for a better world, for an Africa that is united, strong, and free, for brothers and sisters who do not feel inferior anymore. Remind us all the time that it is better to die standing up than to live on our knees. O you noble ancestors, like you, we wish through our actions on earth and this life that you gave us to earn eternal life. Keep us on the path of Ma'at. Help us defeat Esfet, so that our children and our children's children call upon our names. Remind us night and day, whether we are asleep or awake, that unity is our aim and victory is our destiny. Ashe, Ashe, Asheo. Okay, Hotep family. Just wanted to officially kick off our weekly COVID crisis and response conference call with our opening prayer. What was just read for the folks on the line is AI Phillies, or AI as an organization, our daily prayer. If you would like access to that prayer, definitely reach out to us by email or on any of our social medias in the DM and let us know you'd like access, and we can try to get you a copy. So just really quick, the purpose of this continued call that we're having on a weekly basis throughout the duration of this crisis is just an opportunity for us as a community to check in, to stay connected, to give us any updates if you have any health or medical concerns. Also to discuss any essential resource concerns that the community may have, such as food or medicine shortages. And last but not least, to provide any vital updates pertaining to COVID-19. So we have convened together a crisis response team that is made up of myself, Sister Kizzy, Brother Maurice, Sister Tahira, and Sister Wawa. Each of them will speak today to provide a brief update on the current environment related to the crises, health and wellness, safety, communications, and then I'll just give a final update regarding the programs that we're looking to implement to help assist our community during this present moment. So with that being said, I will open up the line, unmute the line, and Sister Kizzy, you can weigh in and just provide us with your environmental update. Thank you.
Good morning, Hotep. This is Kizzy. I will be brief, sweet, and to the point. So, as of yesterday, we were able to test over 16,000 individuals in the city of Philadelphia, 3,728 positive cases, 12,628 negative cases. However, there's still a high risk of community transmission in our area. So, one of the things I just wanted to touch base on that we spoke to last week was concerns around the wearing of homemade masks. So, I just wanted to reiterate sort of some of the ideas that we talked about last week. You really only need these masks if you are going out. If you are going out, you should really only be going out for essential needs, food, medication, or otherwise. Um, and again, they are to be used when it's difficult to maintain your distance in large public settings. People still haven't really sort of grasped onto the idea of social distancing when it comes to going into grocery stores or things like that. I think it's just sort of it's a behavioral thing. We're used to being close to people and standing in line and things like that, and trying to get that out of people's heads is hard. Um, and so wearing the homemade mask in these areas is just an added layer of public health protection in that way. But again, I would like to reiterate that the homemade masks do not keep you as safe as a medical grade mask would, and that's fine because you should be in and out anyway. Um, and you just want to continue to be mindful to watch what you touch, keep your hands away from your face. At all times. There was also some information that was released in the press conference for the city yesterday afternoon that I do want to commend the city on. And by city, I mean our citizens. What we do know is that at least 61% of Philadelphians are doing just that. They're only leaving home for the essential reasons. So that means that people are beginning to listen, but 61% we can do a little bit better. Um, and we know that overall there's been a 69% reduction to close contacts with people outside of the family unit. So things like coworkers, social gatherings, stuff like that. And those are the kind of things that we want to hear. And 90% of Philadelphians have continued to report that they're still washing their hands with soap and water more frequently in order to refrain from getting the infection. So those are kind of my sort of highlights. I don't know if there was anything that anyone had particular questions or about that I could address now. But the primary concern is just making sure that you stay home. And if you don't have the resources in order to stay home because you have to go out and eat, by all means, wear the homemade mask, get the food that you need for your family, and come back home. And if you just are completely and totally disturbed by the idea of having to leave your home and go into these public places in order to receive those resources, as Brother Omawale said at the start, we have worked to get things in place in order to ease that burden on our community and have no hesitation in reaching out to try to figure out how we can facilitate that service for you as well.
Sister Kizzy, I have a couple of questions for you before you jump off the line. So you just said that there were roughly 16,000 people tested, and of that number, close to 4,000 were positive. So that's
Right,
25% of the people tested were positive.
right.
Of that number that was tested and confirmed positive, A, is there racial data on those testing results? And B, were all the people who were confirmed positive, were they symptomatic? Were any of them asymptomatic?
So the racial data is tricky, and this is an issue that is a national issue. It's not just a Philadelphia issue because we're getting information from a number of different sources, a number of different hospitals, a number of different intake facilities. Some facilities have paper forms and they're scribbling things, and race is not something that's on the forefront of their mind. Some are using electronic forms and just don't fill it out. Some of these things are people screaming out words and other people writing on a scrap piece of paper, depending on what the situation is and how much of a burden that facility is at that time. So the racial data that we have is very, very little. I know that of the data that we do have, maybe 15 to 20% of that data includes very clean racial data. Of that 15 or 20% that we do have, the numbers have not changed from last week, and that we have seen an uptick in positive cases in that small fraction of data that we do have that includes race in African American populations. So that was like a very long roundabout way to say the little that we do know about race shows that African Americans seem to have contracted the virus in higher numbers than their white or Asian or otherwise counterparts. Um, as it pertains to who was asymptomatic versus not in getting the positive test, also a little bit tricky to ascertain, because we're still telling people who are asymptomatic to stay home. The information that we do have that shows asymptomatic positive cases are those of healthcare workers. So you can sort of surmise, of course, you would have been exposed. So this is likely how you got the virus while going to work. But for those sort of everyday people who don't directly work in the healthcare facilities or in a space that would immediately expose them to the virus, we're not testing those people. 9 times out of 10, I probably already had it 2 times and didn't even know. Over the last course of a month and a half, I've showed mild symptoms at times, but I was still going into work. I'm still currently here. And they have not prioritized testing us at this point. So um, those
Gotcha.
numbers those data are very sort of few and far in between, and it's a national effort, honestly. And you speak on a good point, because so many people across the nation, so many health departments, hospital systems, et cetera, are 1000% overwhelmed and are not, like, the charge is not being held on a national level, on a local level, on a state level, on a federal level, whatever, to collect these racial data and get the true demographic information outside of age and set gender. Um, I can almost guarantee there's going to be a huge deficit in understanding how this virus has impacted us in particular, and anyone else for that matter, in a marginalized way. Um,
Just one last question, and then I'll let you and I'll
mhm.
just thank you for sharing. The last question is, does the city have any new estimates from its internal models that it's using to figure out when the high water mark will be for the city? Like when do we anticipate reaching the top of the curve here in Philly?
um, so there are some projections, and the I can't give you an exact day. Um, what I can say that I am permitted to say is that by the end of this week, if not middle of next week, I would just encourage people now, like, if you have the time, if you have the resources, if you don't, reach out and ask somebody to begin to start getting, if you see stuff going low in the refrigerator, if you see stuff, like, this is now the time to do that. And I would say before the end of this week, to try to get those kinds of things done, because um, the city has a couple of things that it needs to do between now and then in order to sort of buffer us from what that peak curve looks like,
Hmm.
and we're not quite there yet. So I can't tell you that we're going to reach the peak tomorrow or next week or anything like that, but based off of what I've seen in terms of numbers, we're not that far off, and like this week is your time to sort of get things in order and prepare to be sitting at home for another 2 or 3 weeks.
Okay. Okay. Thank you so much for that update, Sister Kazaya. We really appreciate you just giving us, real information that's coming directly from the front lines as someone who is intimately involved with this situation with your day job, which that's where you currently are. So we're going to let you tap out early. And just again, thank you for your update. Before I move on to Tahir, I just think I just want to share very quickly that of the data that is coming out related to confirmed positives for COVID, 25% of the people who have been confirmed are asymptomatic. Now, what that basically means is that 1 out of every 4 people who actually have it, like they've been tested and they have it, but 1 out of 4 people don't show any symptoms or aren't showing any symptoms. So that means that, 25% of the infected population is walking around not knowing that they have it and are just spreading it to people because they don't have any symptoms showing. So I think, the practice of social distancing, we need to just take an extra measure of caution to make sure that we are not spreading this thing. As Kizzy stated, she could have had it 2 times over already. I myself, because this thing has been here since 2019. My entire family had the flu at the end of February, and it was really, really bad. And we don't get the flu here, so um, just to put that out there, that this thing is spreading. And although we recovered, from our bout with the flu, there are people in our community. I have an aunt right now who's in the ICU with pneumonia. Right, her lungs are building up with fluid, and we're pretty sure that she has it. I have a cousin who was just admitted the day before yesterday to Jefferson and in the city, and they're trying to rule it out, but we're pretty sure she has it as well. So we really have to stay safe and practice social distancing where we can. So with that being said, Sister Tahira, I'm gonna mute myself, and you can unmute and open up your line.
Hotep. Thanks, Brother Omawali, for that lead in. And it's the perfect opportunity to segue into talk about health. This virus is really spreading. And with that, I really just want to stress the importance of us boosting our immune system and really just strengthening the body during this time. There's a lot of talk about masks and whether or not you should wear a mask or you shouldn't. But the bottom line is our immune system is going to be our first line of defense. And we shouldn't get too caught up on any of the physical pieces, say masks and gloves and things like that, because if we are strengthening our bodies on a regular basis, we should be able to rest assured that with additional precautions that we take, we'll be all right. So, with that, it's just a reminder to be intentional when shopping. We really do have to make sure we're being mindful of avoiding processed foods and frozen foods, anything that's really going to just lower our internal frequencies. These foods don't carry high levels of alkalinity or just vibrations in general, since food has their own vibrations. And watch out for foods with added ingredients and preservatives. So, with that, a reminder to consume more fresh fruits, especially the citrus fruits and vegetables. A lot of the green vegetables are going to give you the nutrients that you need, and you can intake those easy ways, salads, smoothies, and things like that. And for our elders, AI Philly has launched AI Philly Care. So, we're doing our best to get fresh produce out to the elders in the community during this time. They may not be able to be as mobile as they need to, but reaching out to AI Philly will get the elders in the network and make sure that they're able to strengthen their immune systems during this time with quality foods. Another note in regards to alcohol, I know a lot of people might be just kicking back right now without a lot of responsibility and intaking more alcohol. So just a reminder, alcohol does thin your blood. And of course, we want to make sure we giving ourselves a fighting chance right now. So consuming alcohol in moderation would be another best practice. And I just want to mention eating out. There aren't any real regulations concerning eating out. So a lot of restaurants are still open. And if you are eating out, I just want to plug supporting our small Black owned businesses, because unfortunately, a lot of them might not make it on the other side of this pandemic. So again, even when you are eating out, just be mindful that you're taking in quality foods, and constant reminders just to drink plenty of water, get sunlight and air, exercise for at least 30 minutes a day, and minimize stress. And AI does have resources available for the community in all of these areas, and we'll add some of those resources to the newsletter communication that is sent out. So thank you.
Thank you so much, Sister Tahira, for that update. Your health, right? First line of defense, keeping that immune system strong. Yeah, you can wear the mask when you go out into public, but remember the mask is just a precautionary, measure to protect other people from you, right? In the event that you may have it, you know what I mean? Because that cloth mask won't prevent it from transmitting to you in the event that there are droplets in the air, right? Because it's not the proper, if you don't have an N95, which is a medical grade mask, a cloth mask is not going to prevent those droplets from getting through and getting into your body. So the cloth mask is really to prevent kind of like this your own spread, right? So for you from spitting, or if you have any droplets, that cloth mask will catch it from you. But what you should ideally be doing, if you have to go out, and a lot of us unfortunately in our community do, we are the most exposed, so many of us have to go out because we are the essential workers. We can't afford to necessarily stay in the house, for more than a week, because we have to get out to do shopping pretty readily. So a lot of us are often, either the most vulnerable and or the most exposed. So that being said, definitely, continue to practice, safe social distancing, and don't let, the mask lure you into a false sense of security. If you have on a cloth mask, know that you can still contract, the virus if you come into close contact with it. So please maintain your social distancing. All right. So that being said, Brother Maurice, I'm gonna mute myself, and you can unmute and just provide a safety update.
What's up, everyone? I just want to reiterate as to what happened earlier on our first call with the when we were infiltrated. Just want to reiterate again how important it is to, while at home, on your computer, to make sure that you vet all those sites that you're going on. Also, if you have any problems on these sites, I would suggest that again that you would call your local local authorities, 911. Also, so not to over burden the 911 system, there's also a service 311 where you have non-emergency situations. So that's another line that you can use if you're having some issues in and around nonviolent type of incidents that may occur in your neighborhood. Like there's an uptick of short dumping. Right now, the sanitation department is picking up trash, but they're rescheduling pickups for recycling. So that's going to be a problem that we've always had in Philadelphia, like short dumping. So that would be a call like to the 311 service. Also want to talk about Philadelphia now. Philadelphia Police now is going to be starting to issue citations for failure to disperse. This was due to the Philadelphia residents in various neighborhoods who did not follow the stay-at-home order that was issued by the mayor. Prior to that, the officers would just, break up outdoor gatherings through verbal instructions, but, hoping that the residents would practice social distancing. But last Monday, there was a case where 5 individuals were shot. One was actually a 2-year-old, and 2 teenagers and 2 adults. They all were females except for the 2-year-old. That happened. They were having a gathering, a party around 10 o'clock last Monday night, and unfortunately, someone had shot into the crowd, and those 5 individuals were, hit. None of them died, but they did sustain some gunshot wounds. And at that point, the mayor and the DA, as well as the commissioner, they all were going back and forth and trying to figure out who, fault it was for the most part. And at that point, the mayor kind of stepped up and made some comments. And as of right now, the way it stands is they're going to start issuing what they call CVNs. They are violations that can add up to about $100. And what happens is if you have 3 or more individuals gathering in a group, pretty much the police are going to pull up and ask the group to disperse. At that time, if they do not disperse, a supervisor will be contacted. Supervisor will then make a decision as to whether or not individuals will be fined. Also, if there's groups out there that just want to disregard police orders, what they're doing is calling a higher authority, the commanders. Upon their arrival, they will then make a decision as to what they'll do from there. And what I believe is going to happen is they're going to start perhaps detaining people. So I wanted to kind of get that out there. Also, update with SEPTA. I'm hearing that SEPTA will be practicing onboarding in the back doors, except for those that are disabled, and they're going to suspend onboarding fare. It just kind of like common sense. We just need to just continue to practice social distancing so we can, bring these numbers down, and we won't overburden the healthcare system. That's why they put in these strategies. So just emphasize social distancing, and if all possible, if you don't need to leave the house, just stay in the house so we can get these numbers down. That's all I have.
Thank you so much, Brother Maurice. As the brother stated, there's a lot going on outside. Now is not the time to be outside. If you can, I understand that, there are times when we all need to leave the house, whether that be to go for a walk, to exercise, just, to get out to get some fresh air. Those are good things, but make sure you're doing it, during the proper hours when it's well lit, and when you can, protect your safety or just be safe. It's unfortunate that folks in the city, there's still lots of violence and shooting going on in the city. So, you know, again, just stay at home if you can. I think we just want to continue to reiterate that the importance of social distancing. So that being said, thank you so much, Brother Maurice. Sister Wahida, you can unmute your line and provide your update.
Good morning, everybody. Um, so what I wanted to do was just reiterate just some quick communication channels. Follow us across our social media pages, and keep in mind to look out for our newsletters. We have a lot of information that we're compiling in there, as well as keeping you guys updated with AI Philly. But I did want to also state that we are going to compile some educational resources. At this time, we do have uh, almost everybody is either overseeing their children's homeschooling, or there's some obvious gaps in children's education right now. So now is a great time to start taking homeschooling seriously. Hashtags homeschool now. So I think that getting the community some resources and some links that they can further research would be great and very helpful. So look out for our newsletter, electronic communication via email for that, and make sure you subscribe to that if you haven't done so. In addition to that, we as Afro-Centricity International, we also have a resource that you can use if you're interested. Please reach out to us. We have 2 African Foundation workbooks that would be ideal for students African children at home to go through these historical figures that are in those workbooks. That's designed for children and teenagers. So please reach out if you're interested in any of that. But otherwise, we will share a compilation of educational resources. Secondly, we thought it would be a good idea to just share a short video. So Brother Omwala, if you wouldn't mind letting me share my screen. I think that it would be good just to play the video for folks at home, folk watching, just to get some basic information again. This is the Urban Science Report from somebody from Philadelphia, actually, who makes these videos.
Wahida, is it okay if we provide that because I think that video is 13 minutes long. So can we share that when we send out the recording to the conference?
Okay, yeah, that's fine. That's fine.
Yeah,
So let me check out that video that has just a good basic bit of information about the COVID-19 situation and viruses and bacteria in general. So that's pretty much it so far for today. If anyone needs to reach out to us, of course, they can always email victory@aiphilly.org, and then follow our social media pages.
Okay, thank you so much, Sister Wahida. And as the video she's referring to was put together by Master Scientist Grand Hank, it is an excellent video that just gives the community knowledge on, hey, what's a virus, what's a pandemic, what's an epidemic, how COVID-19 came about, you know, how it spread. Like, I mean, he really walks us through a 13-minute masterclass of everything that you need to know and to be informed about COVID-19. So we will definitely share that with you all in our update. And please do check it out and subscribe to Master Scientist Grand Hank, because he's definitely a jewel in the community. Okay. So just a quick update from me regarding the programming. I think I stated during our last call that we did kick off the Elder Care program and our partnership with the North Philly Peace Park. So on the last Sunday in March, Brother Shanuti, and who's our leader of the chapter, and Brother Maurice, who's our director of outreach, community outreach, they were able to come up with a list of elders in the community who we dropped off care packages to. These are basically care packages of fresh produce. So we did that. We piloted that program in March. We're going to look to do it again in April. In addition to that, we are still looking for volunteers to assist with shopping, with grocery shopping for the elders and those who are most vulnerable in our community, including the disabled. So if you know anyone who is disabled or an elder in our community that may need assistance with grocery shopping, please let us know. But also, if you would like to volunteer to assist with grocery shopping, please let us know. You can reach out to us at outreach@aiphilly.org. So that being said, this is usually the point where we would open up the call for Q&A, but as stated at the beginning of the call, this morning's conference was compromised, so we had to close out the original Zoom link and open up a new one. What we did is just put a waiting room in place so that people have to be admitted into the conference, so it gives us an opportunity to screen people before we let them in. So we were able to weed out the infiltrators that way. But there were a lot. There was at least a group of 10 that were working together. So they're probably jumping from Zoom link to Zoom link to try to see like where they can cause, chaos, in the middle of a crisis. So that's what white supremacists do. But we can't let them stop what it is that we do, and that's work for our community and look to get things organized and protect ourselves. What I will say, just as a quick update or reminder, I was doing some reading related to the yellow fever, which hit Philadelphia back in 1793, and Richard Allen and Absalom Jones actually published the first ever copyrighted publication, which documented Black Philadelphians' experience during that time. This was the first ever documented publication or copyright written by a Black person in America, the first ever copyright written by a Black person in America. And I was reading through it, and what I found very interesting was Richard Allen was calling out the fact that 2/3 of Black Philadelphia were considered essential workers. So just like or two-thirds of the population of essential workers were Black Philadelphians. So when you look today, we're kind of like in the same situation where our people, we are the essential workers. We're the people you're going to see, in healthcare, right? There's environmental health and safety when you go into the hospital. We don't think about the people who, empty the trash, the people who, the medical disposal, who's throwing that stuff out, right? Who's cleaning these buildings, who's delivering the food, who's driving the Ubers, who's, policing our streets. Like our people, we make up a significant portion of essential workers, and as a result, we are the most vulnerable, right? And the most exposed to this situation. So if you look at cities like Chicago right now and in other cities where racial data is coming out, and you're seeing that Black people are being infected at a higher rate than any other group. So we have to do our part to spread uh, uh, correct information and to spread awareness into how our people can, protect themselves from COVID-19 and to slow down the spread of it in our community. So with that being said, I'm going to ask our lovely sister Tahira to close us out in prayer if no one has any further questions, comments, or concerns. Tahira. Waiting on you. There's a small icon next to your name. It looks like a microphone. If you tap on that icon, you can unmute yourself. I don't know if you see it. Okay. I think this is Tahira maybe having technical difficulties this morning, but I will say just to the Most High, to our ancestors, we just give thanks for bringing us together this morning. We give thanks for your protection, just for good health. We ask that you continue to protect and look over our families, look over our community, help those who are sick or who are ill to be restored and to be recovered. We just ask again that you grant us the wisdom so that we will be wise in our actions and the steps that we take to keep ourselves safe and to keep our community safe. Again, just want to give thanks for bringing us together this morning. Ashe. All right.
I
I
say.
said,
I'm going to end the call here. Thank you so much for that prayer, Sister Tahira. Let me stop live stream.